All right, let's call the meeting to order. Sorry.
12:12.
All right, we'll call the meeting to order. It is 12:12. Okay, so we need to do roll call. I have this list from the last one. Should I just go around or should I just? Oh, you want to do it?
Yep.
Oh,
Yep.
easy.
Monica Isham,
Here.
Julia Lyons,
Here.
Grant Gerber is excused, Andy Alvarado,
Here.
Mike Wohler,
Here.
Tweed Schuman, Doug Rotek, Bruce Paquette, Katie Bellinger, Stephanie Thomas Schmidt is no longer here, so that seat is vacant. John Yackel, Mark Helwig, Elaine Smith, Marshall Savitsky, Kathy McCoy, Bill Trepanier. We have 8.
Okay. So then we're going to go to the next part, which is standing for the Pledge of Allegiance. Okay.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, and certification of compliance with open meeting law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statute.
Thank you. All right, so now we need to go over the agenda, and I think there are some changes we're gonna make.
Yeah, so in the number 11 youth justice update, we were going to have an overview of youth justice. We're going to delay that till next month when we have more members. And then we're going to cross out B as well for truancy ordinance update. That doesn't need to be there. We don't have an ordinance coming forward.
What about for 10B with the opioid funding breakdown?
I can go over that real briefly. We'll have more details in the next 2 months as we move forward, but it gives a current standing of where we're at right now.
Okay. Does anybody have any other changes or additions that they want to make? Hearing and seeing none. So the only change that we're going to make to the agenda is to take out 11B and to push 11A to next month.
Yeah, we'll have just our numbers in there. So rather than the overview.
Okay, so there will be an update, just not A or B.
Mhm.
Okay. All right, so do we need to do a vote on those changes?
I don't think so. I think we can.
No. Okay, all right, so those changes are going to be made for the record on this agenda. Next on the agenda is going to be number 6, public comment. Have any public comment? How would we know if there was one on Zoom? Does somebody put like a hand up or something? Nobody? Okay, all right, so hearing no public comment, we'll move on to number 7, which is approval of the minutes from the previous meeting. Did everybody receive and have an opportunity to review those?
Make a motion to approve the 6/12/24 CJCC minutes.
Get a second? Okay, so one move, 1 second. Any further discussion? All those in favor?
Okay.
All right, motion carries. Those are approved. Next, we have the jail report update.
Thank you. June 24 jail numbers holding steady. 58.25 is our average daily population. 14.75 of those being females, 43.5 being males. Our average probation incarceration is at 15. Pre-sentence incarceration is at 28.5. Average sentence incarceration is at 14.75. We currently have 3 on monitor and we still have 1 working Huber. The population day of this report was 53 with the 73% unemployment rate.
Thank you. Does anybody have any questions or comments?
The working Huber, is he on electric monitor, or that person on electric monitor?
No, he's actually a working Huber. He's the one last that he's kind of being grandfathered.
Grandfathered in?
Yep,
Goes to work, comes back?
correct. Yep.
Like the old days? Okay, thank you.
Like the old days.
I have a question. what is the capacity of our jail?
104.
And right now we have, how many?
Uh,
50?
today, I believe we're at 54 today when I looked.
Okay. Are we bringing people into our jail from other counties at this point?
No, we are not.
Are we staffed to manage 104? I guess that would be, yeah, no, we
No.
couldn't, that
No,
would kind of go to, you're leveled off to
Correct,
the
yeah.
capacity that's there.
So what is the staffing capacity?
we would have to be at, 14 full-time staff members. And we are still currently down no, 3 full-time females yet, so.
Okay, so we do, right now, we have more staffing than our capacity. We're okay, in other words, correct? I mean, right, so is it like, if you have so many prisoners, do you have to have staffing to cover the full capacity of your jail at all times?
Correct, I
Or-
believe that, yeah.
Or is it just you have to have enough staffing based on the population at the current time?
Well, we would have to have, in order for us to double bunk in some of our housing units, we would have to have staffing at full capacity because that would require the 2 utility positions to be utilized.
So are we currently double bunking?
No, we are not double bunking.
Okay. Thanks.
What's the double bunking? What's the double bunking? Like we get to single bunking, what's our maximum? Because 104 is a double bunking.
Correct, it would be, I believe it's 12 less than the 104, so.
Okay.
Great.
Would you-
Anybody have any other questions or comments for the jail report update? Okay. Now, do we have to do a motion to accept the jail report or is that not required? Okay. Okay, so then we can move on to number 9, criminal justice coordinator. Whenever you're ready.
Okay, I see that TAD grant update is listed first. So we submitted our TAD pre-application. I submitted that to Mike Markran on June 21st. He submitted that to DOJ on July 2nd. It was sent back to us with 3 questions and we resubmitted that yesterday. I don't believe it'll come back, fingers crossed. I think that we answered those sufficiently. So we will wait. That the TAD grant is due in November. So we'll move forward with that as planned. Does anybody have any questions about the TAD grant specifically? Okay. I don't, diversion and recovery court, I mean, those are in my rail numbers. Can I just move forward? Okay, so pretrial, currently we're at 151. We have 23 on overcapacity. We did hire for our pretrial and diversion case manager. He started on Monday. Our goal is to get him up and running in the next 6 weeks and to take on a caseload, which would be able to, we would be able to take people off overcapacity. So hopefully that's how our numbers go, like that will hopefully be able to take those people off. We have 10 referrals pending. Currently on diversion, we have 11, and I did pass out a sheet. So you should be able to see those numbers. And diversion, these numbers are since last month. So we have had 3 successful completions, 4 referrals pending. Since last month, we've had no terminations in diversion. Treatment court, there are 8 active, 2 awaiting sentencing, which will put us at capacity. Our plan is to expand treatment court, which would hopefully be able to take on more, but we will see what happens with the TAD grant application. We can't expand if we don't get more funding. So we'll see what happens. we can't take on more referrals because we're at capacity once those two get sentenced, so. Electronic monitor, Lieutenant Willer's, the day he pulled it, we had 3. As of today, we have 2 active, including 1 on alcohol monitor, but we have 1 awaiting sentencing that we know of. So we'll see. That can change day to day. Current jail programs. As of today, we have women's AA, men's AA, multiple Bible study programs. We have Pathways to Home, which is a transitional job services program. We have GED, and for this school year, so the 23-24 school year, we've had 18 diplomas delivered. I know, yeah. Yeah. Very, very successful in that area. And that is due in part, well, all in part to Oralee Connell, who works with Northwoods Tech. We have literacy. We have tutoring. We have financial literacy, which is just starting. And we have guided meditation. So those are the current jail programs that we have. We are working on, if you remember, we just became part of in February, a federal initiative, the Reaching Rural, or I'm sorry, this is a different one, a new one, Rural Community Funding Work Group. So this month I'll go to North Carolina, and it's a National Criminal Justice Association that works closely with state administering agencies to plan for and administer grant in rural areas specifically. So it's a work group that helps seek out rural funding sources. So that should be helpful. Lieutenant Mueller and I are going to North Carolina again in August. Our agenda is to observe the local opioid task force, tour the local detention center and treatment facility, discuss MAT implementation, and meet with local stakeholders. That is all paid for by Reaching Rural. We pay up front, but they reimburse us. So that is not part of anybody's budget. That's all reimbursed. Law enforcement deflection, we have to rewrite, but we received a plan and grant information from Superior. If you remember last month, I said that we all went to Superior, met with them. They sent us all of their information. Our plan is to take that and also take what we get from our visit to North Carolina and implement all of that to rewrite a new plan. So to implement an MAT plan, transitional services moving forward. So that's in the works, but it'll take a little while. I'm assuming 3 to 4 months, hopefully. We'll see. Also, National Night Out is Tuesday, August 6th. Justice Point is sponsoring a booth for our professional visitors, which we have never done anything to recognize our professional visitors. So we are looking for ideas to recognize or acknowledge them. I need help because my brain is tapped out to do something. I'm not looking for help, I'm looking for ideas.
I would talk to Joyce Knowlton.
Okay,
She's got some great ideas.
okay, that will be helpful because I'm not creative. But we need to do something because we've never done anything they spend a lot of time and effort to help our jail residents, and we haven't ever done anything to acknowledge them. So, does anybody have any questions?
I have a question for Andy just. Andy, you're developing the budget now, I assume, correct? And so in that budget is the additional funding there to match the grants that we were talking about as per the motion last month?
There's no additional match. cash.
Okay.
Increase. There's no additional cash match that we don't anticipate at this point. The grant that was turned in, we believe we can match the additional grant request with in-kind.
All right, thank you.
Barb? Okay, I don't think there's any other questions, so you're all set. Thank you.
Okay, we're going on to,
Yep, we'll go on to number 10, so Health and Human Services.
okay, so Joyce had put the report in. And I don't know if there were any questions on that. She's not here today. Sure, you can just pull it up quick and then I'll share on the opioid information. Oh, it's just,
Do have a question.
uh-huh.
We've got that upper portion there, it says type, location, number attended, but
Presentations were not, we haven't done any, this over in July is what that meant, or in June. And, but the total to date that attended presentations was 3,500. So they've done presentations in schools and community places, related to fentanyl awareness. And that was in conjunction with, Sheriff Morotek. So that's what that is.
okay.
I can have her clarify that for the next time, just to have it on there so it makes sense.
We know what that 356 means.
Yep. Okay, any other questions? Not, I'm going to share my screen. Okay. Okay, so last August or September, I believe it was, we brought forward the budget for the opioid settlement. And we really had big lump sum kind of areas that we covered in that. And wanted to kind of give you an update on where we are with current spending. One of the things that I talk about very frequently is braiding and blending funding sources. And what we mean by that is what we do is there are multiple funding sources that we can take advantage of and we don't know that it's going to be coming in. And if it comes in and it fits what we're already trying to be working on, we will use the funding that has more restrictions that would meet that. And we're going to use the funding that expires first. Opioid settlement funds don't have an expiration date on them, although they do have expectations of how we spend by Exhibit E. But there is no expiration date. So if we can use other funding resources, that's what we're doing. So that's why it kind of looks a little complicated as we look through this. So when we think about prevention, we had budgeted $14,850 and so far have spent $5,700. That's what we budgeted through the opioid settlement dollars. Through HHS grants, we budgeted $9,000, we've spent $8,000. So that's kind of what that is meaning. Now, when we get down into advertising, you'll see that we have quite a bit of funds in here. We do expect to be spending, I'm guessing, maybe about 35,000 still, because we don't have everything in. But what we were able to do was we received some money through HHS that we were able to actually divert into that. So that's what we had done. So that's why when you look at HHS, we're in the hole from what we had budgeted, but it is funding that had come through. The support dollars, we do expect to spend that 20,000. So that support section was the School Pulse. And that was the texting connections that we make with psychologists that kids can text, ask questions to 24/7. Parents can ask questions. They also push positive information in dealing with different scenarios. I just broke up with my boyfriend and I don't know what to do, or all those different types of things that cause stresses in people's lives. My parents are getting divorced, all those types of things. So they'll push those pieces through, so they're getting positive information, but also texting back and forth. So LCO has already hooked up with this, as well as Winter School. They're having very positive results with that. Hayward School decided to wait until the fall with all of their construction and everything that they were doing. They wanted to make sure that they were all ready and on the same page to devote the time and effort to implementing this. So we do anticipate that's going to be coming forward. What we had agreed upon through this was we'd pay to get the school started, and then they would continue that through their budgeting process. So that's what that is. And you can see with some harm reduction. So we've spent a lot less than what we anticipated to spend. I know that we still will be under budget for what we anticipated to spend. So we'll take that back, and we are talking to a few different people on where do you see we should be spending some of our funds. And then Andy, are you giving an update of where we're at this time or next time on like what we have for funding with opioid? And I'll still continue here, but.
So we just received an updated settlement payment information. All the counties received it. And so now the current projected amount for Sawyer County is $1,080,675 to be received from the opioid settlements. That includes the distributor and the pharmacy of those that have been settled to date. And that's the lump sum, that's the total amount we should receive by the end of 2038. And so that's, roughly it's anywhere, depending on the year, from 56,000 in the next year, 69, goes up to 73, and then it comes down towards the end of those years, depending on, not all of this settlements are consistent year to year, and some run out sooner. So 1.08 is our total. To date, we received just under 300,000, 293,000. And then the balance we have sitting, some of it's already been obligated towards what Julie has told you is budgeted. We have, let's see, in our opioid account, unspent 246,588.
So when we look at our projections going forward, we'll look at where we're projecting money to be coming in, and then kind of like how much do we want to spend each year, just so that we can kind of, as a committee, kind of think about where is that at. We'll be meeting with law enforcement, Justice Point, Youth Justice, to kind of get some ideas on, okay, where are we seeing some of the major gaps that we could potentially meet. It's not, $1 million sounds like a lot of money, but it's over a long period of time that would come in. We would love to be able to have treatment and recovery centers and everything with the opioid dollars. We know we're not going to be able to do that, but where are the pieces that can come into play? So that you can expect that to be coming forward. Go ahead.
Andy, was it 1.8 or 1.08 expected? Okay, thanks.
And this just kind of goes through, like, we still have invoices coming in for road signs. We plan on a vaping initiative. We're expecting to spend the full billboard dollars. And this talks about some of the stuff I just kind of walked through with us. So some of the progress we wanted to highlight is that more than 3,200 residents have attended the fentanyl presentations, and almost 50% were children under 18. More than 190 residents have taken our online Narcan training, and more than 1,200 residents have received in-person Narcan training. We have established a peer recovery program. And with our advertising views, the gas station ads have had over 50,000 views. Theater ads are receiving about 4,000 views a month. Billboards, 330,000 views a month. So that'll be over 4 million views over 12 months.
Hey, you know that.
I was just thinking.
I wonder how they're like keeping tabs on how many people. use the
Well,
board.
they, it's the drive, the advertise at Lamar, they've got that kind of all figured out because they need to be able to sell that and however they do that, that's what they do. But that's what we're able to do. And we have to show, so some of the funding we used was through HHS grants for the billboards, and we have to show the demographics and the number of views that would be, so. Yeah, so one thing that, some of the things we know we've accomplished now is that fentanyl and overdoses are no longer a secret. People are more comfortable talking about overdoses, loss of life, and actually addiction in their families, and fentanyl. We're just really seeing the people coming out and having conversations and asking questions. So I think I know we achieved what we wanted to achieve with the awareness. The thing that we're doing right now is trying to attach people with addictions to peer recovery coaches and outreach. And then the next phase, which we're hearing a big gap in, is really the vaping, especially with our youth. And so that's, THC, regular vaping, that is in the schools, it's all over the place. It's a big addiction and it's hard to get kids off because we can't just you can't prescribe them patches and different things that you can do for adults. So it's a whole nother mechanism with that cessation. So those are our next steps. Any questions on this? Mhm.
I don't know if it's.
Or in
related.
general, yeah.
Yeah, it's a general question. What's your current focus? Because I remember at one time you had a project working on the advertising, working on this and working on that. Where do you?
So it's, right now, we're focused on growing that peer recovery program and connecting Beziki in with this as well. Julie, our health officer, and I just had a meeting over with Beziki, kind of establishing where we're at and where are our gaps. Things are looking really good as far as therapists and mental health and substance misuse, or MAT over there. So that's looking good. What we're focused on right now is connecting people with addictions or family members with peer recovery coaches or people to talk to. And then the next phase is, so we're doing that through advertising campaigns and through getting out and having conversations.
And one more question.
Mhm.
How is the county looking for as the opioid use? Is it worse? Is it getting better? Do you have any feel on that?
And I don't know that the use is getting any better. It's going to take a little bit before that to transition. What we're hoping to start seeing is more people kind of move into recovery, treatment and recovery, and then being able to spread the word. So I am hearing little inklings, like when I was meeting with Maria at Beziki, that because we're now having these peer recovery coaches in the community who are community members, who have gotten to that other side and are gotten through that addiction. She had said that, they were kind of segregated or chastised by all their friends and kind of because they went down the recovery path, but people are now starting to kind of see the good that's happening in their lives and are coming to them for support. So it takes a little bit to see those changes, but I think we're moving in the right direction.
Similar question, and it might be too early to answer this one too, but do we have any Narcan is fairly readily available from multiple sources
Mhm.
now. Do you have any indication that are we administering it less than law enforcement or in the ambulance, or seen any change in the death rate?
Just our last data meeting was canceled, and I don't know if Joe, if you've pulled that data just recently or not. For just kind of seeing if we're seeing more Narcan that's already been given out in the community before law enforcement or EMS got there. I can bring that back for sure.
So the law enforcement part of it, for June, the calls that we went to for overdoses, law enforcement provided the Narcan on those. Law enforcement and EMS did. And I think in one of the cases, it was June was a low month comparing to the prior months of the year. For overdose incidents, so I don't know if that's just the month or if something's working.
Yeah.
But-
It's too short. The other thing that we know does happen is, if somebody pops up and recovers off of a dose of Narcan, the last thing they're going to do is call EMS or law enforcement. So those are the hidden ones that we really don't know.
They aren't using those QR codes on the.
And they're not using the QR codes. I know, but it's something we were requested to do. We weren't expecting to get much feedback on. Yes, we used it and it worked. But we do know that people are picking them up. We added one in winter in the co-op area, and actually the community is like super excited about that. Other communities are actually asking for something like that to be put in place, so.
So there's really no way to track the ones besides the, excuse me, the EMTs and the sheriff's department?
No,
Ones that, like
we
you said,
just-
that
Yeah, it's,
somebody just gave to somebody.
what we want to see is
Big
our
backlog.
overdose deaths go down. That's really what we want to see. Then we know something's working. We either know Narcan is working or there's less usage. So, but we can't, that's the hard thing with these pieces.
I have a question. Are we seeing a lot more of things not with fentanyl that Narcan is not effective against? I mean, are we starting to see some of that trickle in?
We know it's in the community. I just lost the name of it. too.
I can't
I know.
remember either. Sorry, that's why I was.
And that Narcan, thank you. And so we know it's in the community, but just truly what we're seeing is the fentanyl still and there's usually multiple drugs on board too, so, but it's the fentanyl that's really making the issue with the medical.
Did anybody else have any questions or comments? Do you have more?
Nope, we can go.
Oh, okay. All right. So then that would conclude number 10. Let's move on to number 11, the youth justice update.
Oh,
I think we're still doing an update, but we're taking off A and B.
yeah, I forgot to put the numbers in. I put it in the HHS report and forgot to put them in the CJCC report. And this has some CPS information in here, but this is the thing that I wanted to kind of just zone in on for you to understand what we have going on with youth justice. When we think about out-of-home care, 8 of our kids that are in the youth justice are actually in out-of-home placement. And one of the reasons to bring that up is partly talking about the fact that these are high-risk kids and that's why they are out of home, but it also is impacting our budget numbers immensely. I'm gonna have Sarah come up to the microphone too, because she's gonna be able to answer questions that I'm not going to be able to answer.
As in out of home, as in where they at?
So we have 4, or actually 3 in,
We have 2 in
Claire?
Mendota, which is more mental health.
oh, shoot, I'm not sharing.
However, to get to Mendota, you have to be first placed in Lincoln Hills, which none of us really understand why we have to do things that way. It makes 0 sense. It's more traumatic for these kids, but that is what we are supposed to do. So we have 1 juvenile placed in Lincoln Hills. We have, do I have it broken down? 2 in residential facilities, and then there's the 180 program in Eau Claire where we have 1 juvenile.
And just to look at our program in general, and so our out-of-home placement costs are higher than that we anticipated with that. So
And the kids that are placed out of home, like Julia said, they are high risk. We've tried day treatment, we've tried individual therapy, family therapy, and when all of those things aren't working, that pushes us to have to go to the next level, which would be inpatient. And the kids that are getting sent, I mean, it's for significant offenses that brought them into the system. Especially when kids are sent to Lincoln Hills, those are the most significant offenders.
But that Lincoln Hills individual probably is not gonna go on to the Mendota.
He
Is
will
there-
not. no.
They are, whomever is there because of their actions.
The choices he's made. And I have worked with this young man for the entire almost 2.5 years that I have worked here. He's a very promising young man. He has a lot of potential, but when he comes back to the community, he falls back into old habits.
So, do you want to go, you can just kind of go through your numbers because there might be questions on what some of these things mean as well.
Yep. So in May, we seen our juvenile referrals begin to come down. It's towards the end of the school year. Things quiet down a little. Even for the month of, what was it? June, we didn't have any. And then this month, we've only had one. So we're all breathing a breath of fresh air that there's a little bit of a calm down. Of the 3 total juvenile referrals we had, there was one that we recommended that the DA file a delinquent petition, and 2 of them were kids that we already had on supervision, and so we were able to handle that through their current order. Right now, ongoing supervision, we have 24 informal types of supervision, which is that deferred prosecution agreement. And we have 25 court orders as of the month of May. Current out-of-home placements, as we mentioned, is 8. We had 3 pending cases in court. We have 1 juvenile in the serious juvenile offender program, and we have 1 juvenile with an active KPS, which is a warrant in adult terms. As of May, the total youth justice referrals received are, does that say 27? The total open cases we currently have is 45. I am currently overseeing 2 ongoing cases, and I just had 1 more added. Shannon Kraus has 16 ongoing and 3 pending in court. Kim has 18 ongoing. One of our newest workers is our foster care coordinator position, Amy Thompson, and she has taken 6 of our informal cases. The deferred prosecution agreements are easier to manage. There's not as much involved in them. So she's been nice enough to help us. We have also worked with upper management on getting a limited term employee, and with this 1 new referral we're going to be utilizing, his name is Paul Baraboo, to handle that case.
So one of the things to point out is that really Shannon, Kim, and Amy have been with us for less than 1 year. So it's a pretty high caseload, typically 12. For about a 15 would be for a seasoned worker. So we are very grateful that at this point they're holding on strong, and bringing in Paul just gives them that, at least that mental relief, thinking, okay, if something else comes in, we've got somebody else that can help out with these. Amy, we were lucky enough, she had been interning with us in the youth justice area, and so that's why she was able to kind of move into those cases while still learning her new role as a permanent employee.
Role actually is.
The foster care coordinator and kinship care, so she works a lot with our foster homes. I think something else important to note with all the cases and new workers is while being a supervisor and kind of coming into my new role as well, it's been very challenging with helping train all these new workers, learn more about the CPS side of things. And we were able to, upper management again allowed me to take kind of a step back to better support our youth justice workers rather than having so much to take on myself and even doing case management. So I'm able to kind of slow down and help work them through some of the processes. I know we've been really struggling with our state system. It's called USAQUIS. And when this has been going on for 2 to 3 months now, where we have delays in getting our permanency plans done. And I just want everybody to know that this is something that is out of our control. The state is working on it. I know there's a belief that, oh, well, why can't you just pull open a Microsoft Word document and formulate it in there? In this system, there are literally like 500 different boxes that we need to update and make sure they're correct. And then we have to go in through this other area and update all this information. And it pulls this report together for us. So what I had kind of tried to do last night, and it was a very difficult task to do, is scan the original permanency plan and then export it as a Word document, but then it comes in all wonky. And so like, I want everyone to know we're really struggling in that area, but we're trying to do everything we can. I did just get information from the state that they do have a solution and they're almost there. So just asking for a little bit of patience in that area.
Is there anything that we can do to help with that?
I don't think
No,
so.
I just pushed through. We stayed last night and tried to, it wouldn't even, the e-file wouldn't be accepted either. So, we might have to hand file something if we can't get e-file to work. And then I had pushed through to some regionals. She had pushed through up on a different section. So I think our squeaky wheel is finally getting listened to, but if it isn't, we will have you guys say something too.
Yeah.
Yes, because in different areas, so in this system, it's a very complex system, and nearly every day there is something that goes wrong in this system. Whether it's, workers will go through a whole report and then all of a sudden it doesn't save, and it's very frustrating to us, and we understand it's probably very frustrating to court officials when it seems like we're not doing things in a timely manner, but we are doing everything possible that we can. I think that's it.
Go ahead.
Do you know how many children we have in foster care at this point, roughly?
I do, I had it up on
I
one of
got
the
it right
slides.
here.
Julie will pull it up for me.
Just gotta get back to the,
So, and do we have enough foster parents at this point, or is that a concern still, or is that
We
kind of
are
leveled off?
actually really making progress in the foster home area. Amy is doing a wonderful job, really starting to build relationships and treat these homes like they're cared about and supported.
the report.
We recognize that there have been concerns in that area. So I think to answer your question, we can always use additional foster homes, as each home will say, okay, well, I only want to take children under the age of 4, or I only want to take girls. And many homes, it's a struggle to get, for our naughty kids, juveniles, it's even more complicated to help find a place for them. Right now, we have a total of 33 that are placed out of the home. In non-relative foster homes, we have 21, and children placed with a relative is 2. And court-ordered kinships care, we have 2.
Can I,
Go ahead.
yeah, I was gonna just jump in, and I've said this every time Sarah's talked. A year and a half ago, Sarah was our YJ worker. We only had one. CPS, we were down to 0, so we've rebuilt that. The good thing is this is how I explain it in my own head. In our children and family area, there's really 2 sides. There's like the CPS side and the YJ side. We've made a lot of progress on the CPS side. So those numbers that are up there, they've done a good job of bringing back some of those kids that were in placement and getting them into a closer to the family, less restrictive We have nobody in group home anymore. Residential care, which are expensive, are down to 3. Treatment foster care, we're down to 1. So that's a lot of progress. Now, on the other hand, YJ has kind of taken off on us and maybe it was neglected in the past. So that's why we've been able to shift some of the CPS workers to help Sarah with case management. I did want to just drop in though from a budget impact or county impact, our secure placement for the YJ, we budget 30,000. That's based on historic numbers. Already this year, we've spent like almost 400,000. And Sarah will tell you that these kiddos are not short-term placements, they're long-term placements. So that's gonna hurt. They are making up ground on what we're not spending on the CPS side. So there is some balancing there. Hopefully that can stay the same. But I think what you hear from Sarah, maybe you've heard it already, and when she makes her full pitch, is we're gonna go down the same road we've already gone down with adults of digging in on diversion and those types of things to try to change the tide a little bit. So she's going after dollars and programming to start up youth diversion.
I think that is going to be the biggest hope that we have in this county is to get the funding to start a diversion program and start working with kids in 4th, 5th, 6th grade, because those younger minds are easier to mold, where when you start working with middle school and high school, I mean, they know everything, right? So we are really hopeful and, to start working more with truancy and help support that. We definitely have always recognized the need. It's just we didn't have the capacity to take it on. So we're trying to be proactive in starting new programs and helping move in the right direction.
Under the YJ, maybe I missed, residential, like Mendota, Lincoln Hills 4, but what does the residential mean, the two there?
Residential is basically a step down from Lincoln Hills. It is an out-of-home placement, but the kids basically have to follow along now with kind of more intensive individual therapy and treatment and programming, learning coping skills and life skills.
Where's that at?
It's all over the state. The one that I tend to utilize the most and I tend to be most impressed with is it's nice because it's the closest one to us, and that is Northwest Passage, and that's in Webster. And then the Assessment Center and Girls Program is in Frederick. But there are many residential throughout the state. However, some of our struggles have been in Wisconsin, well, they don't want to take them if the kids are too naughty, or if they have this issue or that issue, or their IQ isn't high enough. It's our mental health kids, it's nearly impossible to place them. So, and that's why, unfortunately, we end up having to first send these mental health kids to Lincoln Hills to then get them into Mendota. It is a very backwards system that really needs to be addressed.
So where are our residential kids
Where are they? They're at Northwest Passage.
in Webster?
There are times where we even have to start to look out of state, which that never excites me because I feel like they are not as trauma-informed, kid-friendly. I mean, they will inject a kid and put them down if they need to. It doesn't make me feel warm and fuzzy, but when we get to the point where there's not one place in Wisconsin that will take a kid and yet they don't meet the level of Lincoln Hills, what do we do?
Well, then the kid feels abandoned also.
Mhm. Yep.
And that's the worst thing you can do for them, of course.
So, I mean, and I have only had to do that one time. And that kid is now, he's our kid in the 180 program, because after sending him out of state, he completed the program and then he was put in a group home in Menominee. Well, he got into an altercation there and they kicked him out. So group homes frustrate me as well because these kids aren't going to be able to meet your expectations up here. These are challenged kids. And so we ended up putting him in the 180 program because, again, the facilities in Wisconsin would not have taken him because we had already been through that and tried that. He is doing wonderfully in the 180 program. And he had said, he's like, I've learned more in the 180 program than I ever did being sent out of state. That's heartbreaking.
I hate to continue on here, but what is the 180 program? I don't think
It's
I've
a
ever.
secure program. And so I guess I said residential is a step below Lincoln Hills. I would say the 180 program is more of the very next thing and then residential, because the 180 program is a secure facility and it's attached to Eau Claire Juvenile Detention Center. Anything else?
So I just want one quick question. So at age 18, do all juveniles automatically age out of the system, basically?
Yes. However, if they're in foster care, we can get them set up with independent living services, which supports them until they're 23 years old. So, but I'm not sure if everybody knows this as well. I'm sure a lot do, but in the state of Wisconsin, when you're 17, you are charged as an adult. It's not 18.
All right, does anybody have any other questions? Otherwise, we should probably move through since we're already at 1:00. All set, thank you. Okay, all right, community services updates? Nope. Outside committee updates? Nope. All right, future agenda items. I know we already talked about moving that youth justice overview to next month of more full presentation. And then are you gonna keep the opioid funding breakdown on there?
Yes, we'll do at least some, if we don't have the full budget ready to go, we'll kind of give some thoughts on where we're thinking we'll make recommendations and get some feedback. So we can just do opioid funding in it.
Okay. What's that?
Uh,
I don't
There
know
isn't
when,
an ordinance, so I'm not sure where we
yeah,
at.
we can take that. Okay, does anybody have anything else they want to have on?
Do we want to can we hear about the law enforcement deflection grant, like how that's going, and are we doing the medical
Well-
assisted therapy at all? Is it worth having an update?
Yes.
Okay.
We'll have an update after.
So September.
Okay.
So September.
Maybe put that on for September then? Okay.
Okay.
Okay. Anything else? Go
I
ahead.
just got an email from Crystal Nordby, Victim Services Coordinator. Did you want me to read that?
Sure.
She says, so far our agency has provided services to 49 victim survivors, 42 females and 7 males. Of those 49, 22 of those are victims of domestic violence, 14 sexual assault, and 13 have both domestic violence and sexual assault. We have been able to assist clients with financial assistance of over $1,500. A lot of referrals are coming from friends, family of Jane Fligstad from Marshville Clinic.
What agency was that?
New Day Advocacy
Uh-huh.
Center.
Crystal, will you be attending every meeting? Like, we can put you on in the community services update.
She said she had to step out, so she may not be there.
Okay, we can connect with her and then
See if we can put her on as her own agenda item
under community
under
services.
community service.
Mhm.
Okay. Okay, thank you. All right, then next would be correspondence reports from conferences and meetings. Don't see anything or anyone jumping up to talk on that. All right, then the next meeting would be
August 14th.
August 14th. Okay, and we're adjourned. Thank you all.